Hello, my name is Katie Simon and this is my video presentation on BRASH syndrome. Because we only have about 5 to 10 minutes or so for this presentation, I'm going to skip over the introduction and learning objectives and the initial case study and move right into the meat of the subject. We'll start with this slide. BRASH syndrome, what does it stand for? There are 5 elements. We've got bradycardia, renal failure, AV nodal blockers, shock, and hyperkalemia. What is it? BRASH syndrome is caused by an exacerbating cycle of renal failure, prescription medications, and hyperkalemia. So what does this mean, or what do I mean by this? A patient who has renal failure is unable to properly eliminate potassium from their body and becomes hyperkalemic. The renal failure also causes an accumulation of AV nodal blockers, such as atenolol, carvedilol, or metoprolol, anything that ends with LOL. The hyperkalemia then synergizes with the excess AV nodal blockers in their system to cause profound bradycardia and hypoperfusion. The hypoperfusion then worsens the renal failure because their kidneys aren't receiving proper perfusion right and further complicates this cycle. This is our vicious cycle photo. As you can see, it starts at the top with renal failure, which leads to hyperkalemia or excess potassium. It also causes an accumulation of beta blockers or calcium channel blockers, and these lead to bradycardia, which leads to poor renal perfusion, and poor renal perfusion leads to increased renal failure. So it really is a vicious cycle. In BRASH syndrome, AV nodal medications nor hyperkalemia alone can explain the profound degree of bradycardia, though BRASH syndrome is often blamed solely on hyperkalemia. You do have to have the 2 elements to create BRASH syndrome. AV nodal blockers and hyperkalemia synergistically cause severe bradycardia and shock. An interesting note is that because of this, BRASH syndrome is often not resolved by initial treatments of hyperkalemia alone, and bradycardia persists even though treatment for hyperkalemia has been given and it's been corrected. Okay, let's talk about the 5 individual elements of BRASH syndrome, starting with B, bradycardia. What are some of the most common causes of bradycardia and hypotension? We've got drugs, AV nodal blockers. AV nodal blocking drugs work by slowing the heart's electrical signal as it passes through the AV node on its way from the atria to the ventricles. These are medications such as beta blockers, calcium channel blockers, and digoxin. Often, our patients with atrial fibrillation will be on AV nodal blocking medications. These medications impair renal excretion of potassium by inhibiting the renin-angiotensin-aldosterone system and altering transmembrane potassium movement. Another thing that can cause bradycardia and hypotension is ischemia. This is often a right coronary artery occlusion that causes an atrioventricular block or sinus bradycardia. Another thing that can cause bradycardia and hypotension is electrolytes. Specifically, we're talking about hyperkalemia or an excess of potassium. Hyperkalemia is a clinical condition that causes a lot of cardiac arrhythmias, and it can be deadly. Potassium is one of the principal electrolytes involved with the electrical conduction of the heart. In paramedic school, I learned it as potassium, which has the symbol of K, is the king of the heart, with sodium being the primary abundant extracellular ion. Total body potassium levels are regulated mostly by the kidneys, with only 5 to 10% of ingested potassium excreted in the feces. When increased intake of potassium occurs, or an accumulation of potassium occurs, as is the case with end-stage renal disease, and when the body is unable to efficiently and properly excrete excess potassium through the kidneys, hyperkalemia is our product. Moving on to R, renal failure. We'll review renal failure. Chronic kidney disease or renal failure is a long-term progressive degradation of renal function. Initially, renal failure can be difficult to detect because as part of the kidneys lose their function, the other part of the kidneys make up for that loss in function by increasing their performance. When kidney function does start to diminish, fluid and electrolyte homeostasis begins to be affected. The patient's ability to make urine is forfeited early on, And then the renal function further declines and the patient loses their ability to eliminate overabundant phosphate, acid, and potassium. So some primary causes of kidney failure, as we know, are diabetes, high blood pressure, but there's also other causes as well, like cystic disease, urologic diseases, and glomerulonephritis. That's a hard word to say. Causes of renal failure can be pre-renal, intrarenal, or post-renal. Pre-renal causes are anything that happened before the kidneys. They're things that eliminate blood flow or decrease blood flow to the kidneys and cause hypoperfusion. This can be a sudden and severe drop in blood pressure, such as the case in shock, or it can be an interruption of blood flow to the kidneys from an injury to that area, or it can be from severe hemorrhage or an illness that causes severe fluid loss too. Renal failure can be due to intrarenal issues, which would be a direct damage to the kidneys. This can be caused by inflammation or toxins. It can be caused by drug damage, infections, or reduced blood supply. Renal failure can also be caused by post-renal causes. This is anything that happens beyond the kidneys. This can be a sudden obstruction of urine flow due to enlarged prostates. It could be due to kidney stones, bladder tumors, or injuries or problems with the urethra. It's anything that happens beyond the kidneys. So to get sciencey here for a second, renal excretion of potassium is determined by the rate of potassium filtration across the glomerular basement membrane, and also by its rate of secretion and reabsorption in the distal tubules of the nephron. This whole picture here is a picture of a nephron. The glomerulus is a tiny ball-shaped structure composed of capillary blood vessels, and it's located at the beginning of the nephron in the kidney. It's involved in the filtration of blood to form urine, and waste products get filtered here. Potassium gets filtered out through the distal tubule area, which is that number 3, as you can see, up kind of behind the glomerulus. Here's another view of it. This is where we're going to stop our slideshow presentation for the video production. The rest of the slideshow goes on to talk about the other 3 elements of BRASH syndrome, including AV nodal, drugs, shock, and hyperkalemia. It also goes on to talk about EKG changes associated with BRASH syndrome, case studies, pre-hospital treatments for patients with BRASH syndrome, additional treatment considerations in the hospital, and then it goes over the ACLS bradycardic algorithm, and then finishes at the end with some group activities for the classes to perform. But for now, since we're almost at our time limit, that's what we're going to do for today. So I hope you enjoyed this little snippet of BRASH syndrome, and I thank you so much for your time.